A content video presentation by Dr.Neethu Elizabeth Antony, Senior Lecturer in the Department of Prosthodontics, SRM Dental College, Ramapuram. In this video presentation, I will be demonstrating the alginate impression making. Alginate is an elastic, irreversible hydrocolloid impression material. It is one of the most frequently used dental material as it is simple and cost effective. Alginate impression can be used as a preliminary impression opposing dentition impression for the fabrication of provisional restorations and study models. Chair positioning for alginate impression. The patient should be seated upright in a comfortable position with head resting firmly on the headrest. Chair height and position is adjusted to a comfortable working position for the dentist. For maxillary impression, the dentist should stand behind the patient, that is at 11 o'clock position, and for the mandibular impression, the dentist should stand in front of the patient at 7 o'clock position. Tray selection for alginate impression. Perforated Stokes trays are used for alginate impression. Most frequently, the stock trays would require some customization in the form of tray modification. Tray modification can be done with wax, impression compound, heavy bodied silicone depending upon the operator's convenience. This video demonstrates a tray selection for the alginate impression. The tray should extend about 2 to 3 mm beyond the molars. Similarly for mandibular tray also. There should be about 3 to 5 mm clearance with the soft tissue. For maxillary and mandibular impression. Alginate mixing. A scoop is provided for measuring the powder and a measuring cylinder for water proportion. A clean, flexible rubber bowl and a clean, wide bladed metal or plastic spatula is used. The impression trays selected should be kept ready. This video demonstrates alginate mixing. As you can see in this video, the mixing is initiated by adding measured quantity of water to a clean, flexible rubber bowl. This is followed by the addition of correctly proportioned alginate powder. The cold water can be used if longer working time is desired. Setting time should be controlled by varying the water temperature and not by changing the consistency of the mix. Once the powder is dispersed into the liquid, the mixing is begun by wetting the powder particles with the measured amount of water. Once the entire powder is wetted, the mixing is wrapped with a wide bladed spatula in the figure of 8 motion, or can swipe against the sides of the bowl to release the entrapped air to avoid air bubbles in the impression. The resultant mix should be creamy in consistency but must not drip off from the spatula when lifted from the bowl. Next, coming to the maxillary alginate impression. Once the powder is added to the measured amount of water, the mixing is initiated in a rapid manner in the figure of 8 motion, or can swipe it around the sides of the rubber ball. Once you get a uniform or creamy consistency of the mix, the material can be loaded into the tray. For a maxillary impression, the tray must be filled with impression material up to the tray borders, and any excess unsupported material at the periphery must be removed with the mixing spatula. The tray has to be centered in the position in the patient mouth with the light pressure. The soft tissue, especially the labial mucosa, should be relieved and manipulated for the alginate to flow into the sulci and record the necessary details. Once the impression material is set, the impression has to be removed in a firm and quick snap. The impression should not be rocked or twisted before or during the removal of the impression. Next, coming to the mandibular alginate impression. After the mixing of alginate, it is loaded into the impression tray and is inserted such that it is in line with the patient's midface. Manipulate the patient's cheek, lips, ask the patient to raise the tongue and move it from side to side to record the anatomy. After being removed from the mouth, the alginate impression should be evaluated for recording adequate structural details. The impression must be free of any debris, voids, and must be sufficiently attached to the tray. After the evaluation, the impression should be rinsed with cold water or running water to remove any saliva and blood, and the washed impression should be disinfected by means of practitioner's choice of disinfection procedure. Next, it can be continued with the cast pouring. Hope the video presentation was useful. Thank you.